In the previous episode, we focused on how to approach a forensic autopsy. We talked about the importance of triage, building a mental framework before making the first cut. That process begins long before internal examination, because even before an incision is made, the body begins to speak. External examination is the first structured observation of the deceased. It's the earliest chance to gather information without altering the body's natural state. In forensic practice, it happens in two stages. The first takes place before the autopsy, often in the morgue. It is done in the presence of the public prosecutor. This is a legal step required by Article 86 of the Turkish Criminal Procedure Code. Its purpose is to determine whether there is suspicion of criminal involvement and whether a full autopsy is necessary. The second stage occurs during autopsy, before the internal dissection begins. Here, the forensic physician performs a more detailed inspection, documenting injuries, identifying signs of trauma, disease or neglect, and preserving visible evidence. The external examination acts as the first witness. It may not explain how a person died, but it often tells us where to look. The position of the body, the clothing, the color and condition of the skin, all of these offer subtle but meaningful clues. We observe livor mortis, the purple discoloration of the skin caused by gravitational pooling of blood after death. Its location, intensity, and fixation help estimate time since death and whether the body was moved. Rigor mortis, the stiffening of muscles due to ATP depletion, also gives information about timing. The pattern of stiffness can even reveal whether the body was manipulated after death. In many cases, we find signs that are not related to the cause of death, but are still highly informative. Old scars, tattoos, medical devices, signs of malnutrition, poor hygiene, needle marks. These tell us about the person's history, their lifestyle, or their vulnerability. Sometimes what we see outside helps explain what we find inside, and sometimes it raises more questions than it answers. In Turkish law, the external examination by the prosecutor is not symbolic, it's investigative. If the findings raise suspicion, Article 87 mandates a full forensic autopsy, and the procedure cannot proceed without the prosecutor's written authorization. In this way, external findings do not just guide science, they initiate legal action. During autopsy, the external findings continue to shape our approach. They help decide where to dissect more carefully, what samples to take, and what hypotheses to test. All these external examination findings are more than just observations. They are stepping stones in a greater process. Each mark, each clue, each piece of evidence carries its own weight. When carefully considered, they shape the scale of interpretation. A well-guided forensic path leads not only to a conclusion, but to the truth by the shortest possible path. The skin is not just a covering, it's a layer of silent testimony. The body whispers its truth, not through speech, but through signs. And it is our role as forensic experts to listen, carefully, completely. From the Handbook of Forensic Autopsy by Dr. Murat Nihat Arslan, available now.